Yes, hello everyone. In the video of today, we are going to cut down, we are going to share something important. First of all, thank you so much for joining the platform. Before we continue, make sure you go to our YouTube channel, Dr. Kampala, subscribe and watch the videos that are there. You also on TikTok, go on TikTok, follow our platform such that you can always get notified every single moment we post videos like this. Now, in the video of today, we are going to focus. We are going to understand why is it that in HIV or people living with HIV, at sometimes they tend to be agitated, they tend to lack innovation, they tend to be in a mania phase, they tend to have a lot of behavioral problems, they tend to forget, they usually have a tendency of forgetfulness, and sometimes they also have a tendency of difficulty in performing complex tasks, and also they tend to have a problem or difficulty in concentrating and reading. So in this particular video, I want you to understand why or how does it happen. Many of the times out there, we get pissed with these people living with HIV. Sometimes we go ahead and insult them, and yet in the actual sense, it is not that they intend to do what they are doing. So I expect somebody who is watching this video, after watching and understanding what we are going to cover in this video, no more insultation or people living with HIV, no more easily getting pissed at them, because you are going to understand in the next few minutes. So I beg you continue with this video up to the end, such that you can understand clearly the picture of how it happens. And mind you, sometimes they present with things like shizas or queska. They also present with things like headaches. Sometimes they present with things like paralysis. Sometimes they can also present with things like inability to move any part of the body or inability to see. All that one is centered from the brain. Now in this video, I want us to understand how does it come about. And first of all, I urge you to run to our YouTube channel, you subscribe, you follow, such that every single moment we post videos like this, you can always get notified. Now, in a nutshell, this is what really happens here. First of all, remember, HIV is an external virus. It's coming from the outside. Now it has entered the body system. When it comes into the body system, when it accesses the body system, it starts to fight to see how it can survive. And in the areas where it accesses, the brain is also inclusive. Therefore, this is the way how it does it. Number one, that HIV virus itself can go ahead and access the brain inside and start disorganizing it or damaging it. Or secondly, when it is there, the immune system obusirikale bw'omubiri is also fighting that same virus. As it is fighting that virus, it can end up causing damage to the brain cells themselves. Remember, on top of the immune cells trying to fight the HIV virus and damage the immune cell, it is also producing other chemicals which are helping it still to fight that virus. In this, we have the cytokines. And these cytokines can also start slowly by slowly. And this can happen slowly by slowly over years. It can even take what you may not even think of. So as a result, this slow progression of damage resulting to the things I have explained above. Secondly, we could also have opportunistic infections. Whenever we have HIV, opportunistic infections that, remember in HIV, the immune system is low. And if it is low, it means the other infections are also getting chance, which would have not affected the brain, are also getting chance to affect it. For example, we have in bacteria, we can have TB. Yes, TB can also go to the brain and start damaging it. Secondly, we could also have in a class of fungi, we could have histoplasma, cryptococcal, also going to the brain and start disturbing it. Then we could also have protozoa infections also crossing to the brain, as I have told you. Then we could also have drugs. Gone are the days, there are some drugs of HIV that cross and enter into the brain and start causing all the messes I have explained above. And we could also have, yes, we could also have cancers of the brain. Remember in HIV, the immune system is very low to fight against the abnormalities in the body. So it means developing the cancers in the brain, it is also increased in people living with HIV. Now, because of what I have explained above, by the way, before I even go further, did you know that in that HIV itself, HIV virus, when we come to the people living with HIV, when you get their brains, we find HIV virus in their brain, and this accounts for what we call dementia. And dementia continues to progressively become intense until it comes to later stages. So in the end, people living with HIV tend to, number one, cognition. Their cognition tends to be really poor. Secondly, they tend to be forgetfulness. Thirdly, they tend to be with problems in performing tasks which are very complex. Secondly, they easily become agitated. Thirdly, we could also have episodes of mania in some of them. Mania, somebody becomes hyperactive, completely hyperactive. Then the other, we could also have irritability. Even something small that would have not resulted into getting irritable, this person will get irritable because of that. Then we have a lot of behavioral changes that really comes around because of this dementia and what I have explained above. And when it comes to even reading, just reading, for example, in class, if it's a child living with HIV not on treatment, even the ability to read may be, yes. When it comes to reading may also become difficult in people living with HIV. Secondly, so for what we have explained, make sure when you meet a person living with HIV, don't get pissed at them. Don't get pissed at a given particular moment because of what I have explained. So, thank you so much for your attention. Thank you so much. Make sure you follow this platform. Make sure you run to our YouTube channel such that you can get notified every single moment we post videos like this. Now, I expect a person who have watched this video not to always get pissed, not to always overreact, not to always react in an unnecessary way with the people living with HIV, because now I expect you to have understood what really goes on inside. Okay, so thank you so much for today. Thank you so much. Make sure you always follow the platforms Dr. Kampala such that you can always get notified every single moment we post videos like these ones. So for now, I'll have to say bye bye.